Welcome to the USMLE Question and Answer Blitz. We are diving into a high-yield questions. Remember, in the exam, you get 90 seconds per question in a 60-minute block covering 40 USMLE questions. Get your coffee? Let's nail this case and keep rocking our 40-question block. Alright, so let's look at the high-yield pharmacology question. A researcher is developing a new diabetes medications derived from the saliva of Gila monster. It has structural similarity to GLP-1 but does not act as a GLP-1 receptor agonist. Instead, the drug inhibits the enzyme dipeptidyl peptidase 4 or DPP, the enzyme that normally breaks down GLP-1. The question asks which of the following approved drugs works through a similar mechanism. This is a classic step 1 style question that tests both drug mechanism and comparative pharmacology. Let's break down the options in the next slide. Alright, so the correct answer is D, Sitagliptin. Sitagliptin is a DPP-4 inhibitor. It works by preventing the breakdown of endogenous incretin hormone like GLP-1 or GIP. This leads to increased insulin secretion, reduced glucagon release, and better glycemic control, especially in patients with type 2 diabetes. This matches the description of the experimental drug, which boosts GLP-1 levels by inhibiting DPP-4, not by activating the GLP-1 receptor directly. Let's quickly go over the incorrect options. A. Pramlintide is an amylin analog that slows gastric emptying and suppresses glucagon, unrelated to GLP-1 or DPP-4. B. Canagliflozin is a SGLT2 inhibitor. It increases glucose excretion through the urine. C. Exenatide is a GLP-1 receptor agonist which mimics GLP-1, but the experimental drug does not act via that pathway. E. Metformin reduces hepatic glucose production, again a different mechanism entirely. So among the choices, only Sitagliptin shares the same pathway as the new drug, DPP-4 inhibition. Now, here's the key takeaway. GLP-1 receptor agonists like Exenatide directly stimulate GLP-1 receptors to enhance glucose secretions. In contrast, DPP-4 inhibitors like Sitagliptin prevent the breakdown of naturally occurring GLP-1, thereby prolonging its action. For step 1, always remember, if a drug doesn't act like GLP-1 itself but enhances its effect by preventing degradation, you're looking for DPP-4 inhibitor. This distinction between mimicking a hormone and preserving it is a common concept tested in USMLE pharmacology. Thank you, and I will see you soon.